Hello, YouTube. Um, this is like my 5th try at doing this video. I gotta hand it to everyone that does these videos that look so great and fantastic. Dang, it's harder. I understand now. It's harder than it looks. It really is, because it's like you think what you want to say and sometimes it just doesn't come out right. So anyway, you guys, all the YouTubers and anyone that's watching this video, there's so many wonderful videos out there, and just if you've been making videos, I've probably watched them. Thank you so much. I mean, they're so appreciated. I really question whether or not that I would really have anything to contribute to the whole discussion regarding weight loss surgery and VSG. And I kind of realize I do, because I kind of have a little bit of a different circumstance. To give you some background, I am 42 years old. I live in California. I'm 5'4", which I wish that everybody would mention how tall they are at the very beginning, because I always listen for that and a lot of people don't say it, but I'm 5'4". My highest weight ever was 261, and that was during a period when I was quite ill, and so that was about a year ago. I do suffer from chronic illness, and so a year ago was definitely a really, really bad time. I have naturally been able to drop down a little bit since kind of getting a little bit better with that. So my weight has sort of been hovering around 250 for really about a year since then, because I'd actually, before I went up to 260, I'd actually been at like 235 or 240. So it was a really drastic weight gain, and it was caused from my, I have an autoimmune disease, and it was very uncontrolled at the time. Even though I'm under medical supervision, it just I guess I just went too long between appointments, and we didn't catch it that I was so sick. And one of the symptoms of that disorder is sort of a little bit of brain fog, so I wasn't even aware, to be honest, of how sick that I was. But anyway, the highest weight I've been recently was 252 point something, and I've been on the pre-op diet. So this is a pre-op video. I've been on the pre-op for just one little day, and I cannot believe that I have lost 4 pounds. I just can't. I can't believe it. I can't believe it. It's just shocking to me. It's just shocking. The reason I'm having weight loss surgery is because for the past 5 years, I have worked and worked and worked and worked and tried and tried and tried and tried to lose weight. And I've done like low carb, low calorie, low everything. The last like program I tried was keto. Now keto was where I was the most successful. And the reason I say I was the most successful is, even though I did not lose any weight at all, I felt the best while eating keto than I had on any other diet program that I've ever been on. So that will definitely be my goal to, in a couple months, being able to go back to a keto lifestyle, because it really, I felt, for me, who I have lived many years of not feeling good, keto, I felt the best that I could, considering all of the other crap that I have to it's all the stuff that's beyond my control that sort of is the problem. So the only thing I really can control is my eating. And so if you are looking at this and you're pre-op or you're post-op and you're down the road and you're maybe looking for something, I really do, and I do see a lot of weight loss surgery people going on a keto lifestyle, and I'm definitely going to go that route as well. So tomorrow I go in for surgery at 10 o'clock. I'll be having surgery at El Camino Hospital in Mountain View, California. I'm absolutely thrilled about this. The decision to not to actually have surgery, but to start talking about it, start looking into it, was about a year ago. And it was really the doctors that brought it up, because I'd been to a nutritionist, and the doctors finally realized, I kind of had their little light bulb moment, that here's a lady that is struggling so much because of all these health ailments, and I was trying so hard to lose weight and to constantly look at the scale and have it raise another few pounds, another 5 pounds. I mean, I'm the type of body and I'm sure a lot of you might have the same problem, but I'm the type of body type that can gain 5 pounds in 1 week. And that's not an exaggeration, or certainly nothing to brag about, you know, I'll tell you. But that gaining 5 pounds was not because I was binging on a bunch of junk. That was just a normal eating, and that was me eating more of a probably a normal diet versus eating like low calorie, or low carb. So my body, um, thyroid disease, endometriosis, blood sugar irregularities, like a sluggish pancreas, um, reactive hypoglycemia. I mean, I've got just so much crap, and now I've got asthma that I was just recently diagnosed with. That I'm having to take the steroid inhalers, and 3 inhalers a day for asthma, which I've only had asthma since for the past, like, I would say 2 years, and only diagnosed literally last week because of the weight gain. So I have autoimmune diseases that have caused weight gain, and now I'm having health issues caused because I gained the weight from the up, you know what I mean? So it's kind of like a domino effect. I've been trying so hard to lose weight, and so a year ago is when I started talking to the doctor, found out from my insurance what I needed to do, and that was, so I needed to go to 6 months of nutritional counseling classes. I had to do a psych eval, a sleep study. I'd actually already done that, and I already knew I had sleep apnea at that point, which I have severe sleep apnea apparently, which is new, caused from the weight gain. It wasn't something I've always had. And I also have a really hard time with the CPAP machine, so that's kind of like a whole nother topic. But just, dang, all these things that are just, I feel like there's like this little puppet pulling all the strings on my health. And for once in my life, I'm like, you know what? This is going to be for me. I choose this for me. So, like I was saying, like a year ago is when I started looking into it, and what I ended up doing was saying, okay, it takes this amount of time to go through this process. I'm going to work like crazy to try to lose weight. And if I can do it on my own, if I see any progress, I'm not doing the surgery. That was like my mindset. And so it wasn't until about a month ago, when it was time to go to the doctor to like kind of get things set up, that I was like, okay, I've been trying. And the doctors were trying to help me. They were trying to prescribe medications and trying to control my thyroid and my blood sugar. And they were trying so many things, because the doctor, my endocrinologist, was like, okay, give me 6 months to try to get this worked out. So I'd give him a few more months, and he was like, okay, give me 3 more months to try to get this worked out. And the weight just isn't coming off. And so I finally made the decision about a month ago, and I'm so glad I did. I'm so glad that I went through this process, and I wasn't like, even though I was undecided, I put myself in the position to where at any point I could make that final decision. Because man, what if I hadn't done that? Right now, if I had not done this a whole year ago and decided, okay, I'm going to go through the process, even though I'm not sure if I'm going to do it, where would I be right now? I would, who knows how much weight I could end up gaining in that amount of time in the future. And now it's tomorrow. I'm just, looking back at it, and all the struggles and all the health problems and all the times that there have been things that I couldn't fix, I couldn't control. And I've just had so much ramifications from my weight. I'm not able to, this is very personal, and but this is reality. I cannot sleep in the bed with my husband right now because, he is in a job where he has to be a 100%. And having a wife that tosses and turns and snores and has hot flashes all night long. So I'm rolling all over the place. I'm loud because I'm snoring, and like the covers are on and they're off. They're on, they're off. We tried to go from a queen size bed to a king size bed, hoping that would help. It just didn't. And the fact that all night long, my husband, he's like trying to wake me up to say, okay, stop rolling all over the place, or stop snoring, or whatever the case. That means he's not sleeping. If something were to happen to him because he didn't get a good night's sleep, I can't bear it. I couldn't bear it. And I don't want to even risk it. But that means that I'm sleeping in a guest bedroom right now. And that effect on my marriage is so significant that this surgery could literally save my marriage. And I'm not doing it for him. I'm doing it for me, so that, because I'm the one that chooses to sleep on the couch or to sleep in the guest room. It's not him saying, hey honey, I can't sleep, you need to be out of the bed. It's not him. This is totally on me. So this is my hope to get my asthma under control, my sleep apnea under control, get my, yes, it's losing weight. I mean, it's going to be so fun being able to go out and buying like all the cutesy little outfits, because, you know, I used to dress a lot differently than I do now. I kind of dress a little more cover-up-ish. Not that, you know what I mean, like long shirts and baggy clothes and stuff. Whereas once I start to lose weight, I'm hoping that I can have the physical energy to be able to go for hikes like I used to, maybe play tennis again, you know, do more things. I live on the coast. I have a beach that's 10 minutes drive for me. Go on walks on the beach, take my dogs out. I want to be able to kind of live my life fully, where right now I really don't feel like I'm able to do that. And I want to get back into my bed. And, you know, this is going to sound silly, but my bed in my master bedroom, it's new. It is the most comfortable bed I've ever had in my entire life. Yet I don't get to sleep in it hardly ever. So I want to be back, but it's not just the bed. You know, yes, it's the bed. It's comfortable. I want to be sleeping next to my husband. You know, I want to be able to have that intimacy. And I don't necessarily mean physical intimacy. I mean, you know, just that bond you have, you know, with your spouse. I mean, with us basically living in separate rooms, there's a huge disconnect in our relationship. We've been together since I was 15 years old. I'm 42 now. Like, forever I've been with this man. You know, I absolutely adore him, but this is bringing out characteristics in our relationship that are just no good. No, they're not healthy relationship. It's not a healthy relationship, and something's got to change. So I've got a lot of hope for this. And plus, you know, my kids, they're now both young adults. Soon they'll be getting married maybe, and, you know, having grandkids. And so I want to be able to play with them and not have the my number one, you know, symptom of all of my junk is extreme fatigue. And that's what I want. I just want to be able to get up and just do whatever I want, you know. So that's what I look forward to. So I've got so much hope. Tomorrow is like, it's like day one. I'm so excited. I'm not at all worried about the surgery. Like I said, I've had so many surgeries, much others have been much more severe and much more well, you know, that's kind of funny, but the other ones have been pretty life-changing, potentially, if they had gone wrong. But thankfully they went right. This one is life-changing, and it's going to be life-changing for the positive. So I'm so excited. So hopefully this helped some people maybe find some hope, and I'll try to touch base. And you know, it's so hard to lose weight when you've got these medical ailments, and especially, you know, and I know that other people wouldn't have my specific combination, and that's kind of been my problem. But if I can give some hope, regardless of whether someone's doing VSG or other bariatric surgery, or if they're just trying to lose weight, just to know that you can lose weight if you've got, you know, Graves' disease and you've had a thyroidectomy, to know that, you know, you can overcome blood sugar issues and the reactive hypoglycemia, and, you know, hysterectomy, and all these things. And even with having the physical ailments that I have in terms of my inability to do a great deal of exercise at this point, because the surgery could improve that greatly. I don't know.